Hi, this is Gene Ransom, CEO of MedCai. And given all the discussion in the news about race with what's going on in our country, I thought it'd be interesting to look at some Maryland health disparity data, specifically racial disparity data in Maryland for three important issues: COVID, diabetes, and maternal mortality. And I thought COVID would be a good place to start because it's in the news. Looking at the raw data from COVID, and this information comes from the Maryland Department of Health. As of June 1st, 2020, you can see that African Americans significantly outnumbered whites, and Hispanics also outnumber whites in raw cases. This is particularly alarming given the fact that when you put it on a per capita basis, these numbers look even more alarming, that both Hispanics and African Americans are much more likely to get COVID or have gotten it at a much greater rate than white people in Maryland. Deaths have fared a little better. As you can see, white people have had slightly more deaths, and actually Hispanics seem to do better than both classes given the number of cases they've had. Again, it's hard with this data. Again, this data is also from the Maryland Department of Health. But remember, and the reason they have a probable death category too is because there can be complexity in determining the cause of death with regards to this. And I'm not sure how good or how bad this data is, but I thought this raw data was interesting and should be shared as we look at it. Here's the real raw data for COVID in Maryland as of June 1st, 2020. And again, this is directly from the Maryland Department of Health. You can go on the Maryland Department of Health website, and they update it daily and give a lot of information. But as of June 1st, 2020, there were 16,857 African American cases, there were 11,468 white cases, and there were 15,394 Hispanic cases. This is very, very troubling because it shows that African Americans and Hispanics are getting cases at a really high rate. Again, if you take this data and put it on a percentage basis based on the population in Maryland, and while Maryland does have a larger African American population than some other states, this still is very alarming and shows that it's a red flag for those two communities. Moving to diabetes, and right here I have diabetes data from the CDC. This data comes from the 2018 survey, and it's the percentage by race of who has diabetes. The gray bar is Marylanders. The blue bar is US. I thought it'd be interesting to see. And if you look, you'll see that Hispanics actually do a little better than the national average here in Maryland. Blacks and white people are about on par. American Indians are doing a little worse than the average US, as are other. But I think it's interesting to see that actually in most cases they're pretty close, that Maryland seems to be pretty standard. These numbers are obviously rather alarming. Looking at raw data though, again, what we see, which is very troubling, is that again, African Americans, Black people are more likely to have diabetes as a percentage in the population than white people. Now, this is percentages, so it's a percentage of population, so it's a little better comparison, and maybe it's a little more honest. The other comparison you saw before probably didn't show the magnitude of the racial disparity, but still, you got the idea that it was pretty bad. In this case, you can see that American Indians and African Americans have significantly higher rates of diabetes than African Americans. And this is actually the case not just in Maryland, but also in the United States with regards to this data, where I have data from both Maryland and the United States to compare. By far, probably the most troubling of the three data sets that really shows the extent of this public health disparity between the African American or Black community and the white community is the maternal mortality data. The Maryland Department of Health just released the MMR report, and that report shows that African Black women have in the United States have a 2.4 times greater than white woman disparity for maternal mortality. The MMR report showed that compared to 2008 to 2012, the 2013, 2017 data, white people's maternal mortality decreased by 34%, and African Americans or Black folks' maternal mortality increased by 11.9%. Clearly, this is incredibly troubling. In Maryland, you have a very high maternal mortality issue. There's a major racial disparity with regards to this, and it's just very troubling when you look at it and see it. The full report, again, is available on the Maryland Department of Health website, and I'm willing to put it up on I'll put a link to it in the notes on this video. But again, maternal mortality for African Americans is by far worse, and those data, those staggering points from that annual report that just came out in 2020 is startling and scary. MedChi, the Maryland State Medical Society, recently released a statement discussing racism as a public health crisis, and made some assertions to try to make things better. MedChi is the largest, foremost physician organization in the state of Maryland, and they have pledged to work to deal with this issue. And they made the following assertions in a public statement. They asserted that racism is a public health crisis that affects all communities, while disproportionately and tragically impacting communities of color. And I think that was clearly shown by the data I just shared with you. They have pledged to apply a racial equity lens to a thorough review of all state and local ordinances, grant management activities, vendor selections, and government contracts. They've stated that they want to see the state adequately fund and develop educational resources to expand understanding of racism and its effects on individual and population health. They've asked to adequately fund and develop community engagement activities, resources, and alliance to address health disparities. And they have asked to adequately fund and develop new and/or existing training programs with completion requirements for law enforcement, elected officials, staff funders, and grantees on implicit bias. So this is a pretty strong position that the Maryland State Medical Society has come out with regards to racism to try to address this issue. If you want to learn more about what MedChi is doing, the website is there, www.medchi.org, or you can always reach out to me on Twitter. Thank you for listening and learning a little bit about racial disparity data in Maryland and seeing the magnitude of the problem that we face and we need to deal with.